Welcome back. It's now time to go in depth. Two-thirds of Jamaica's medical doctors staged a mass sickout on Thursday, leaving patients lined up at hospitals and forcing hospitals to only accept emergency cases. So why such drastic measures? Well, on the phone is the president of the Jamaica Medical Doctors Association, JMDA, Dane Miller, and we're hoping to be joined later on by Littleton Tanny Shirley from the Southeastern Regional Health Authority. Welcome.
Good evening.
So, Mr. Miller, doctors are staging this sickout basically because you want a reclassification exercise to be done. Why is this so important?
Well, I'd first like to say that it's not because we want a reclassification exercise to be done. It has been done. There are issues that we have had with how it has been done. But it is not only reclassification that we have a problem with. There are a myriad of other issues that have been affecting our membership over years, for which we have tried to deal with these issues with the government. And for those who have the opportunity to view Minister Dalley and his response today, you will realize the arrogance that we have to deal with.
Well, we're going to get to that, but from what I understand, the reclassification is the most important of the many issues that you guys have. Is that correct?
No, it is not the most important. It is one of many important issues.
What would you say is the most important?
What I would say is the most important is what is happening to healthcare in Jamaica. What is the government's plan for healthcare? There have been changes over the years. There has been no user fee policy, which has put the institutions, and if you ask any of them, it has, well, they may not say it because they are governed by a code of conduct, but it has put them under strain in terms of finding the resources to equip the hospitals, and this has left those who are the ones in charge of designing, of diagnosing, designing, and implementing healthcare at a severe deficit in providing that care that we know we can provide and we know that our patients deserve. And in some cases, you know, we find ourselves not being able to treat our patients the way we want and the way they need to be treated. You have doctors who we go above and beyond in providing healthcare. We most times are at work beyond our contractual hours. After 4 o'clock, we get to work before 8 o'clock. I've been in operations that have lasted 19 hours and that going to 3, 4 o'clock in the morning when I should have been off work from 4 p.m. that afternoon. And this is only my experience. Everybody has gone through this. You have doctors who come out for free on weekends to ensure that their patients are seen and get the best care that they can get. And you look now to a ministry or to administration, and not just this administration, but successive administration, for them to provide you with adequate resources to ensure that you have good working conditions, ensure that your pension benefits are taken care of, ensure that, you know, there's adequate training in the profession so that, you know, patients have access to specialist care. And the way that all these issues are being treated it's with such disdain that, you know, it engenders a deep worry and concern about what is the way forward.
Now, you mentioned earlier that Minister Horace Dalley, the minister with responsibility for the public service, he had kind of an arrogant response. We did get a chance to speak with him earlier, and let's listen to what he had to say.
The reclassification was something that the nurses fought for. Mm-hmm. The nurses went to IDT, went to court, and fought for reclassification on their own. Later on, the other medical groups join them. The previous administration, the one before this one, established a mechanism to implement reclassification. They agreed that they would establish a panel and that any concerns regarding the reclassification would be referred to the panel. The doctors agreed to that and all other groups agreed to that. The closer you come to the actual implementation, the difficulties are seen. And they have refused to abide by what they said earlier, that we will go with whatever the panel says. That said, is history. This is a new administration. We are prepared to sit with them.
So what's your response to that, Dane?
That the panel, there are issues with the panel, and in terms of what Minister Dalley is saying about other health groups were joined in. It is the ministry that decided that they were going to, they were the ones that are going to reclassify the whole health sector, not just the nurses. We did not ask to be reclassified. Yes, the nurses wanted to be reclassified, but the administration, not in their wisdom, decided to reclassify the entire health sector. And
so, but he's basically saying that it was the nurses' fight and you all are kind of now piggybacking on their fight.
No, we're not piggybacking on. They decided to include us into this.
Now, he also had some other comments about how much what the doctors are requesting will cost the government. Let's listen to that clip.
We know what the concerns are. They have told us, but those concerns have financial implications for the budget. And therefore, you can't just, in a simplistic way, say, I will do that and I will satisfy your demand. All of these things have been explained to the doctors. They know the budget we have to work with. They know that we sympathize with their cause. We know that what they say might have some merit, but at the same time, it has implications for the budget.
And for the public at large.
And for the public. I hope that the doctors will become well tonight and they all will go back to work tomorrow and await the outcome of our meeting with them. And later on tomorrow I will tell you what is the implication of what they would like to see happen. It's over $1 billion.
So we all know that these are very lean economic times. The minister says this will cost the government over $1 billion, what you're requesting. You still there?
Yes, I'm still here.
You heard his response just now?
This is not about dollars and cents or money, right? And again, this is not only about reclassification. The government will want everybody to think it's about money and this and that. They did not think about lean times when they were deciding to equip themselves with reliable modes of transportation. In the same way, we are asking them to equip their hospitals so that their people can be treated properly. And with regards to reclassification, before they decided to make any budget, they knew that there were problems, and they have persisted in their way forward. And despite what the minister has to say about being sympathetic, obviously if he's sympathetic, we would not be at this stage. So you cannot take him at his word, because if he's sympathetic, after having been dealing with this issue ever since he became Minister in Public Service, why are we at this point?
Well, you mentioned earlier that one of
what the public needs to ask the government, and more pointedly, Minister Dalley, why are we at this point after you have been meeting with the doctors? Why are you at this point? Why?
Very good question. Well, unfortunately, we're out of time, and we'll definitely continue following the story and try to find out the answer to that question and others. Thanks for joining us, Dane.
You're most welcome. Thanks for having me.
All right, Dr. Dane Miller, president of the Jamaica Medical Doctors Association. Of course, we'll continue following the issue. That's going to do it for In Depth for tonight. Stay tuned. After the break, it's time for sports.